This is my second lecture in KSM. So today I have selected this topic on digital screen exposure and childhood speech development. The background story is like this. Okay. So the background story is that about 2 years back, the government launched a program called Include Program. And this Include Program is a program where people, but one of the major problems we pediatricians had was there were children with a lot of development disabilities which were referred to us at a later stage. They were not picked up at an early stage, right? Because parents did not have enough knowledge to pick up a child with a development disorder and refer to us. So what the government did was, there was a program where the midwife and the MOH, Medical Officer of Health, will actively screen the community for development disorders and then refer those children to us. So it was a movement where we are trying to detect development delay at a very early stage. So during the last 2 years, we had about 400 clinic referrals and 75% were referrals due to speech and language related problems, right? So about 3 out of 4 children who come with a development problem were having speech and language delay. So I'm not an expert on speech and language delay. So during the last 2 years, I also learned about this, and there were some wonderful facts which I thought I should share with the community. So the objective of the lecture is to give you some information as a first contact doctor regarding these digital screens and language development. And also, I know most of you are parents. The medical students don't have to get excited, right? I'm talking about the front rows. Most of you are parents, so you might use this information for your personal use as well. So before we start the lecture, I would like to show these two. If by any chance I was going to be half an hour delayed and you were forced to look at a cartoon for the next 30 minutes, which cartoon will you select? How many of you will select Winnie the Pooh? Okay. Motu Patlu? 1, 2, yeah. I know most of you are lying, right? A lot of you will go to what? Winnie the Pooh or Motu Patlu? Motu Patlu, right? You are adults, so you know Winnie the Pooh is better, right? I'm talking about if we show this to about children about around 5 to 6 years old, how many of them will select Winnie the Pooh? No, right? Most of the children will go towards Motu Patlu. There was research. Right? There was research using these two cartoons in India. And 80% of children said they are more happy to look at Motu Patlu rather than Winnie the Pooh. So compared to those children, you are much better. Right? So we'll see what's the difference later on. I'll show you the slide later on. So before we talk about digital screen, we need to know what speech and language delay. Speech and language delay are two different things. Speech and, although we say speech and language, there's a speech delay and a language delay. Speech delay is child's conversational speech is either more incoherent, that means we can't understand them properly, for the expected development age, okay? Or there's a speech sound error pattern. Now this is the definition of speech delay. I have made it more simple. So if a child has an articulation problem, like for example, making speech sounds using mouth, lips, and tongue is different, that child has a speech disorder. For example, some children can't say rabbit, they will say wabbit. Okay, so articulation problem. Ala balan. A 2-year-old child saying ala balanna, that means ara balanna, they will say ala balanna, I won't be worried. 5-year-old child saying ala balan, there's a worry because articulation is not developed. Or they can have a voice problem. When we are talking, we should talk loud and then slow down with a high tone and a low tone. But some children can't do it. There's especially children with autism, they speak with the same tone. Okay. And then fluency errors. Fluency means the rhythm is damaged. So some children have a very slow rhythm, like that, slurred speech, or a very fast rhythm, right? So that's where you get stuttering. Okay? So if you have a problem with articulation, tone, or the voice, or the rhythm, you have a speech disorder, right? On the other hand, language disorder is a difficulty in responding to language, understanding the words, learning the first words, or building vocabulary, right? So in other words, they have trouble making new words, right? Or learning new words. For example, some children will say, I am friend with him. The correct word should be, I am friendly with him, right? So they have this trouble making new words using the words they already know. Okay? Or they have problem with putting words together. Mother went out. The child with a language disorder might say, mother out went, right? They are trying to organize the words in a different way. Or they can't use the phrase in a different mood, right? So in different moods, we use the phrases in a different way, right? So if we are in a good mood and if someone is doing something wrong, we'll say, please don't do it. Right? But if that person is not doing it, we have to say, don't do it. Right? As according to the different mood, there's a different way of saying. Some children doesn't understand that. Right? So if they have trouble learning new words, putting them into sentences in a different way, or they don't know how to, speech according to the different moods, that child has a language disorder. Okay? So speech disorder, language disorders, they are two different categories. So what are the common speech disorders? One is called childhood speech apraxia. Second one is dysarthria, orofacial myofunctional disorder, speech and sound disorders, stuttering. I'll show you these 5 disorders using a diagram. So when we are producing speech, we need the brain. Then we need the mouth, lips, tongue, and the nasal cavity. That is the mechanical part. Brain is the functional part. And there should be a pathway where signals are sent from the brain to the mechanical components. Okay. So speech apraxia means the child has normal lips, mouth, tongue, and nasal passage, a normal brain, but the pathway where it connects has a problem. Okay? So children with apraxia know what to tell, right? They have the lips and mouth prepared in such a way that they can speak, but the signal doesn't come properly. So they know what to tell, but they can't tell. They get stuck. So these children sometimes tell only part of the word. They know this is a banana, but they can't tell it banana. They will say nana. That's all, right? So after some time, the mother will know when you say nana, it's a banana, but we can't understand. So they might go to a shop and say, I want one nana. Mother will say, it's a banana, right? Because they have a problem, but in their mind, they know what to take. In dysarthria, what happens is the brain is normal, pathways are normal, but the mechanical parts, the mouth, tongue, lips, the muscles are not moving properly. So in apraxia, there's a problem with the mechanical components. Nothing wrong with the brain. Sorry, not apraxia, dysarthria. In orofunctional myofunctional disorder, there's a problem with the mouth, lips, tongue, as well as the nasal cavity and oropharyngeal cavity. Okay, so it's much more complex than simple dysarthria. In speech and sound disorders, there's nothing wrong with the mechanical element, the mouth, pharynx normal, but there's something wrong with the speech production part in the brain. So the problem is in the brain cortex. Okay, in stuttering, or gotagahana, right? Again, the problem is in the brain. Okay, so there are only 3 problems: one in the brain, one in our mouth, lips, nose, tongue, the mechanical parts, or the third one is the pathway which connect the brain with our mechanical parts. Okay, right. Then language disorders, there are 4 common language disorders. One is called late language emergence. Second one is called late bloomers. This you might have heard that in villages, they know that sometimes who will have a slightly delayed speech, boys or girls? Yeah, boys, right? There's a common thing where some people will know that, okay, right? That is normal, right? Late bloomers. Elective mutism or selective mutism and dyslexia. So we'll go one by one. Whatever the language disorder, you can divide them into 2 languages, right? One is receptive language disorder. Child can't either hear or understand what others are telling. expressive language delay. Child hear, understand, but they don't know how to tell, what to tell, when to tell. Right? So it's either a reception problem or expression problem. Those are the two main language. Whatever the language disorder, they come under these two, reception or expression. So late language emergence, the first language disorder, is a delay in language onset with no other diagnosed disabilities or development delays in other cognitive or motor domains. So the child will run and climb stairs. They will have normal hand functions. They will have normal social development, right? They will have normal hearing, but their language is delayed. That is called late language emergence. All the other development milestones normal, only language affected. And the late language development, there are two types, as I said before, expression delay and comprehension delay. Expression delay is they understand and follow commands, but they have difficulty putting ideas into words. Okay? They use very minimum words, but they are very good in hand language, right? So sign language. So when they want water, they will say, right? They have good understanding. They know where the water bottle is. Sometimes they will hold the mother's hand, take the mother, point to the bottle and say, give it to me, right? And we made the classic error. We also give the bottle. So next time they want the water, they will not say water because they know, and the mother will also give it, right? Okay. In comprehension delay, which is more worse, the child doesn't understand. Sometimes the mothers will complain, my child hear well, but doesn't listen. Right? Sometimes, but be careful. Sometimes children are creatures who are always trying to create trouble to the parents. So sometimes even if they know what the mother is still, they'll pretend that they can't hear just to get the fun of mother getting excited. Okay, that's a different story, right? But these children, they actually have a problem. So they hear what you are telling, but they don't understand or they don't listen, right? And again, their expression is minimal. They have sometimes language of their own, only mother can sometimes understand. And sometimes they might catch up, might not, but catch up will happen only with intervention. That is the danger. These children, if you wait, watch and wait, they will not improve. You have to interfere and treat. Okay? On the other hand, and these children sometimes can have other disorders like autism, ADHD, social communication disorder, learning disability, right? So this is not a simple thing where you can just watch and wait. But on the other hand, there are some children called late bloomers, similar to LLE, right? Similar to late language emergence, but they spontaneously catch up. Right? You don't have to do anything; they will spontaneously catch up. How you differentiate from late language emergence is their sign language is more advanced, right? And there is usually a family history, right? Usually the culprit is father, right? Right? Okay, so father is always create. And comprehension is never affected. They understand very well. They speak slowly, but later on, even without intervention, they catch up. Right? Late language emergence, with intervention, they can catch up. That's the difference, right? Then elective mutism and selective mutism. Elective mutism is an old term. We don't use it anymore, right? Selective mutism is child can speak very well at home or with close relatives, but when they go to a new place, they get stuck. That is due to excitement or anxiety, right? Although the word says selective, the child doesn't, sometimes child without illness, they are bored with the relatives, so they will select not to speak, right? Children should have that, what you call the human right, right? Some relations are not very, they are very boring, so the child select, right? That is normal. Here, the child want to speak, but he can't because of hyper anxiety state, and they freeze, right? So these children have always fidgeting, they are fidgeting around. They have poor eye contact because they know if they make eye contact, the people will ask them to speak. So best thing is to avoid eye contact, then we will not ask. Again, sometimes seen with final year medical students during ward rounds, right? Non-verbal communication. They have non-verbal communication, and very commonly the class teacher will say, this child has very good writing skills. He's very good at work, but he never read at class, right? Reading period is a part. So sometimes they cut the reading period, but they are very good in the other ones, right? So they don't debate, never, right? No debating, no reading, nothing, because they get freezed, right? Then dyslexia is a learning disorder where you have problem with accurate reading and spelling, poor verbal memory, and poor word processing. So some children, even a simple thing like cat, if you ask them to write C-A-T, cat, they will write. If you read them, C-A-T. If you give C and T and put A-O-U, although it looks very simple to us, they have difficulty finding whether it's A-O-O-O-U. Okay. The other one is, again, they are reluctant to read aloud in class because they get mixed up. Third one, they get confusing letters with similar shapes, B and D. Okay. Or sometimes P and Q. They are very similar, so they mix it up. And then sometimes they know the correct letters, but don't put it in correct way. So animal, they will write as aminal. The letters are correct, but the ordering is wrong. And sometimes they forget to put a space between two words. So the words are written correctly, but connected. Sometimes they put a space at the middle of the word. Okay. So it's very difficult. But when they are reading something by memory, they do a good job. Right? So it's mainly with this visual. And if a child is coming with dyslexia, always ask the mother to bring the child's school books. When you go through, you will know. Okay. So speech and language delay, why do we get speech and language delay? There are common causes: cerebral palsy, hearing loss, anatomical defects, mainly with speech, intellectual impairment. Then we learned about late language emergence, bilingualism. Children who are exposed to two languages can have a delay initially, but then they later catch up. Okay. Genetic conditions like syndromes, autistic spectrum disorder, psychological deprivation. Then finally, we come to our main topic, lack of stimulation. So today we are going to talk about lack of stimulation affecting speech and language. In Sri Lanka, lack of stimulation can't happen because we have extended family structure. There is a lot of siblings. Sri Lankans love gossiping, right? There is crowded neighborhood, many family gatherings, and many multicultural events. So a child theoretically should be exposed to a lot of speech, right? So whenever we don't have something, people go to the other house and start a gossip. Right? We are always talking, right? So why are our children who are under a lot of this verbal environment not stimulated? Then there must be something which is putting them away from the stimuli. That is digital screen. Right? So when the child is involved with the digital screen, although there may be 3 or 4 kids, all the kids are not talking with each other, but all are having their own smartphones. Right? There are crowded neighborhoods, but neighborhood is now silent because all are browsing. Okay? Many family gatherings, they come and go through their phones rather than talking with each other. Right? And digital screen exposure is exposure of a child to different digital media devices, such as, it's not only television, entertainment gadgets like game consoles, tablets, DVD, work devices, laptop, desktops, multifunctional devices, the smartphone, and even electronic book is a digital screen exposure. Now, why are we worried about excess digital screen exposure? These are the bad effects. It will reduce the social skills and attention span. Children who are on phones will have a very low attention span. They have a delayed language acquisition. That's why we are doing this lecture today. Their cognition is impaired. Their sleep pattern will be disrupted. They will not sleep properly. There are risk of behavioral issues and sedentary lifestyles. So we don't have time to go through all. We are going to focus only on delayed language acquisition. So do we have guidelines on digital screen exposure? Yes, we have guidelines. Up to 1.5 years old, or 24 months, sorry, 2 years. The WHO or American Academy of Pediatric guidelines is no screens up to 2 years, nothing, right? Except video chatting. Say the father is abroad, the mother is using the phone for Skype, video chatting. That is okay because you are talking with the person. Otherwise, no screens. Not even chuttappa. No, right? No screen. Right? From 18 to 20 months, you can use 30 minutes at educational media with an adult. Right? From 2 years to 5 years, no more than 1 hour. Non-educational material, no more than 1 hour. Why I have mentioned non-educational material, now even preschoolers, they have Zoom sessions. So those are okay, right? But non-educational, although this is 1 hour, for a time, it should be 30 minutes. So altogether 1 hour. So you can't have run the below 5 years, right? Then Indian Academy, which India is near to us, so they have their own guidelines, same. 0 to 2 years, no screen. 2 to 5 years, adult supervised 1 hour. 5 to 10 years, 1 to 2 hours, again 30 minutes each. Right? So 30 minutes break, 30 minutes break, another 30 minutes. You can't have a stretch of 1 hour. Right? So why are we having a lot of guidelines? Because the prevalence of excessive DSC in children below 5 years is going up. In middle income countries, it has gone up from 24 to 98%, right? Almost 100%. Then there was a Thai study which shows that average TV watching hours in infants is 1.2 hours in infants, where the TV watching hours should be 0. It's 1.2 average, right? Then, okay, you might say that is Thailand. Why we worry? We have a Sri Lankan study between 2 years and 5 years old. 60% use TV, smartphone for more than 1 hour. 20% use for more than 2 hours. So it's far from the accepted guidelines. And risk factors are single child because they get all the luxury, right? You have one child, all the luxury. Maternal employment, mother is working, father is working. So the child is with a grandfather or grandmother who can't run around. So the best way to keep the child at one place is give a phone and keep him, right? Or male sex. If you are a male child, more chance of addicting to a phone. Then children who start watching TV before 1 year of age for more than 2 hours a day, they are 6 times more prone to get a language delay, right? Not one, not twice, 3 times, 4, 6 times, right? And children who watch more than 2 hours of screen, any age, below 5 years, you have a low score on communication skills. Okay? So that is the real danger of digital screen. So below 2 years of age, what is the importance of face-to-face interaction? When a child is speaking with us, these are the advantages. The child listens to speak as well as observe non-verbal cues, right? And facial expressions. When we are talking with the child, they can see what's happening in our face, the cues. Okay? And the reader, that means I can vary my pace according to the child's reaction. Right? Okay? And the child has time to understand, ask questions, and reply. Okay? Then the child can develop her own non-verbal skills. He can connect emotionally with the adult, and they can learn to switch roles. That means I can become the listener, the child reader, the child listener, I am the reader. Okay? Does this happen with the screen? Face-to-face? No. There are no cues. You are just looking at the screen. A reader can vary. No. The screen will go according to its pace. The child has to now adapt. Okay? He can't. There's no flexibility. No time to understand. The child can't question the screen. Right? Child can develop her own verbal skills. No, he can't. Can't connect emotionally with the screen and can't switch roles. Right? So no advantage at all compared to face-to-face interaction. So negative effects is, these are the main negative. When the child is with the screen, he doesn't get bored. He's always occupied. So he will never become interested in creative activity. Now, those days when we were kids, we did not have screens, so we had to do something to make us. So this kurumbatti machine, any child who you have seen making a kurumbatti machine these days? No, you ask them to make, they will first ask, what is a kurumbatti? Right? Right? You know, paper rockets. Do children make paper rockets? When we were medical students, there was always rockets flying in our pediatric wards. Right? None, no, nothing. Right? They are always, what are they doing? They take the parents' phone, and because they don't get bored, they don't need to be creative. No need, right? Whenever you feel bored, you have the phone. You don't need to create anything. Child is not frustrated when you are in the phone. Right? So because all the time when you want something, that's it, you get it. But when the phone is out, the child gets frustrated because now he can't handle the stress. What happens is if you want something, the child, 2-year-old child will do like this quickly. That's it. They want water, they will also walk. And then the water will not come at the same pace, they get angry. Right? Okay. Then the child, the biggest thing is they confuse the real world and the digital world. They think that what is happening in the digital world is equal to the real world. That is below 2 years. Right? And minimize socialization, that is obvious. And they are sedated during screen time, hyperactive after the screen time. Now that is called sedation hyperactive loop. Okay. Now what we'll see what happens. When you are looking at a screen for a child, the child is glued to the television, then dopamine will flow to the brain and blood supply to the frontal lobe will be reduced. Right? When the frontal lobe blood supply is reduced, you get an activated stress response. Right? Okay. Now, we switch off the screen. What happens? The dopamine level suddenly drops. Right? But your frontal lobe doesn't have enough blood supply. So all the activities like problem solving, impulse control, creativity, those things are gone now. Right? And now the child is in the what mode? Stressful mode. So they are always in the fight or flight mode. Right? So during the screen time, they are glued and sedated. As soon as you remove the screen, they become hyperactive. Right? Because they are either trying to fight or flight. Okay? That's the danger of this sedation hyperactive loop. I'm talking about the below 2-year age group. Right? We might not get this. We are talking about children. So any benefits of digital screen exposure? Yes, there are benefits. There is an educational value. So you can't completely take the screens out. There is an educational value. Yes, if you correctly use the digital screen for a child, it can expand the vocabulary. Right? 2. Number 3, children who are exposed to various experiences and cultural linguistic diversities. Because through a screen, you can teach them about other countries, what are the other cultural events which happens in other countries. You don't need to go to a country, right? So those benefits are there. And also, to a certain level, the digital screen can keep them occupied at a safer level. Because while in front of a screen, they don't fall. Right? So head injuries, those things can be minimized. Right? So why is digital screen exposure in the rise? Because of the COVID-19 lockdown. Parents started going to work. The caregiver find it easier to use the screen to comfort the child. And the common excuse the grandparents do tell is that with the screen, they can keep the child at one place. So they don't need to worry about other injuries. Okay? And when the child is attached to the screen, no temper tantrums. Okay? And parents are also addicted to screens. So when the parent is looking at the screen, obviously the child will also start doing it. And false belief that screens will improve their child's learning abilities without supervision. They think that by giving a tap, the learning abilities will go up. So what are the red flags in your child, which will tell you that there's a language delay? If there's a delay in speech milestones, normally by 6 months, the child should babble. Babble means at least monosyllabic babbling. Ah, ga, ka, ba, ba, la, like that. The child is not using those, you have to worry. No first word by at least 15 months. 1 year, 3 months, no word, worry. No consistent words by 18 months. Consistent word means if you are saying amma to amma, that should be consistent. You can't say amma today and tata tomorrow, right? So you have to have a consistent word set by 18. Vocabulary should be at least 50 by 2 years. And by 2 years, if the child is not preparing 2-word sentences, you need to worry. If you can't understand your child's speech by 2 years, you should understand at least 50%, right? Then there's a worry. If the strangers can't understand the child's speech by 3 years, so your own child, 50% of what the child is talking, you should understand by 2 years. If you are a stranger, 50% of the child speaking should be understood by you as a stranger by 3 years of age. Okay. Normally by 4 years, anyone should understand what the child is saying. Okay. Speaking in English when all the other family members are speaking in local language. Do you think mothers are worried or proud? Yeah, some mothers are very proud. අපේ කාටවත් සිංහල ඉංග්‍රීසි බෑ. බබා හොඳට කතා කරනවා. English is a very basic language. It's not a very advanced language. Right? We think that our English is a big language. No. Asian languages, Sinhalese, Tamil, Arabic, Bhutanese, those are very advanced languages. English is a very simple language. Look at the letters. I, A. Anyone can learn. A, that's it, right? I. P. I got them B. Right? Nothing much to learn. Right? So if a child has a learning disability and he is exposed to English and a language like Asian language, what language will the child choose? English. So the fact that he choose English and leave out this difficult language tell you that he has a language disorder. Okay? A child who has a normal development should learn both languages. Right? So if a child is completely refusing the local language and speak only with English, don't be proud. There's a problem with his learning development. He can't understand complex words because our language is very complex. See how many nerves we have? Learn, right? So many things, right? So therefore, a child selecting only English is a danger sign. So red flags by 18 months, over dependent on hand gestures, right? No words at all, only hand gestures. Problem. Then by 2 years, only simple nouns, no verbs. Or simple verbs only. They know only no, go, don't, aya, that's all, right? Everyone will learn EPA because that's the way you can refuse the food, right? So EPA, no famous words for children. Just because your child know how to say EPA, no, that doesn't mean he is good in language, right? Then only nouns, but no verbs. Some children have nouns, but no verbs. Danger sign. Then sometimes vocabulary is advanced, but poor in language. About 1 week back, I had a child who is not speaking at 2 years, no words, no sentences, only 4 words. One word is antarasdahan. So he know antarasdahan, but on the rest of the vocabulary, only 4. So why? He's watching a television cartoon all the time, and one famous word which is repeatedly telecasted in that cartoon is antarasdahan. So he knows antarasdahan. He knows amma, ayya, epa, antarasdahan. So if you just concentrate on antarasdahan, yes, amma, very good advanced word, but only 4 words. So if you have an advanced word but poor in language, red flag sign. And some children leave words out of sentences, right? If the child is repeatedly leaving certain words out, that's a red flag sign. So management. Management, there are 2 things, right? Final part of our lecture, parental awareness, medical intervention. I'm not an expert in medical intervention. There are speech and language therapists and behavior therapists who will do that job. I'm now going to concentrate on parental awareness and input because prevention is better and it can minimize the damage rather than treating. Okay? So how we can prevent digital screen exposure related learning difficulties. Right? So do's and don'ts. These are the do's. Focus on communication. Talk with your baby, sing, imitate sounds and gestures all the time. Right? And read to your child. You don't need for the child to become older. Even at infancy stage, it's okay to read to the child so that the child gets the idea that we should talk, right? Read. Then encourage children to look at pictures when you are pointing, right? Pointing, and that is called joint attention. That's a very important thing. When you are learning, when you are behaving with a child, you need joint attention, right? A lot of children with autism, they play, but they don't have joint attention. They don't join people. They are in their own world, parent in their own world, right? You need this joint attention. And use everyday situation to build your child's speech and language. When you are doing something, talk your way through that, right? Or when you are going to a grocery store, name the items with the child and explain what you are doing while cooking or while cleaning, right? Don't do it while doing, explain it, tell it, so that the child's vocabularies improved, right? Then avoid baby talk, right? To a certain degree, baby talk is okay, right? For a 6-month-old child, baby talk. Sometimes the child is 2 years, 3 years, mother is still doing baby talk. That is not good, okay? Baba kakkidan, no, there's nothing called kakki, right? Baba kakada, that's right? No baby talk, right? Then avoid mixing language. Baba sit karanna, that is the most common mistake, right? You would have heard. The mother is telling, Baba sit karan. Sit is a verb, karan is a verb. So Baba verb doesn't match. Either say Baba sit, or Baba vadiya. Right? Don't mix up. Okay? And avoid using wrong commands. Very common thing. Right? When you are calling your child, you say puta. And when some child is not doing something bad, what do they say? Epa or hemata? Hey, puta. Right? The child get confused. Kata karanit puta, epa kiyanit puta. Right? So you can't. So if some child is doing something wrong, use the word epa. Right? The correct word, the correct command. And don't encourage hand signals. If the child is using a lot of hand signals and you are also doing what the child wants, you are encouraging hand signals rather than improving his vocabulary. Okay? Then do's and do nots regarding digital screens. Right. So you have to avoid passive screen time as much as possible. So for example, no screen till 2 years. Then active screen time with educational value, that is okay. But again, maximum 30 minutes per session, 1 hour per day until the child is 5 years old. Then parent guided viewing, because when we are having a parent guided viewing, we can talk with the child, watch, explain and ask questions. Right? If the child can't understand, we can rewind. If it's a program which can be rewind, right? And then play it again. Then you can select high quality programs or interactive programs like Dora. And remember, have you seen Dora? Dora walks, sees some animal, the Dora turns and asks a question and gives time for the child to answer and then again go back, right? So the child is interacting. Okay? So when you are having a parent-guided screen watching, you can have real-time face-to-face interaction. Can you remember this slide where we were talking about the advantages of face-to-face? So when you are viewing the program with the child, you can again have this same advantages, right? So the most important thing is not the duration actually. It is what the children are watching. Okay, that is the quality of the show and how they watch it, whether alone or interacting with an adult or at least by himself. That is more important than the duration of the time, right? So sometimes a child might watch 1 hour. You might think that is too much. But if it's a good high quality program with a lot of interaction, which is done with you as a guide, then it has less harm, right? Compared to a 30 minutes show where no interaction, child is watching alone, not learning anything. Okay, so duration, yes, important, but not as important as what and how they are watching it. So parenting tips for creating a safe digital environment. You can preview your apps, games, movies before introducing to kids. There is a app called Common Sense Media. This is the media where they give a rating. So, for example, you can say Inside to Out cartoon, it's recommended only from 6 years and above. Then Bad Boys, 16 plus, right? No bad boys for below 16. House of Dragon, above 17. Mario, above 8. Like that, they give a rating, right? For any app or any cartoon, you can decide whether it's good to your child using this, what is the app called? Common Sense Media, right? Then always avoid fast-paced apps, right? Very fast apps where the screen is changing every 4 seconds. That's a fast medium for a child, right? A single screen should last more than 4 seconds for a child to understand. So anything below 4 seconds and quickly moving, that's not a good app for a child. Always talk about the movies, games, or even play with them. You can play with the child. No screen 1 hour before sleep. If you have a screen, even for the adults, no screen 1 hour before sleep. If you look at a screen and fall asleep, your sleep will not be a pure sleep. You will have troubled sleep, right? So no screen for 1 hour before sleep. No screen during meal time. And it's better if you can have 1 day without screen. Okay. So out of 7 days, you can tell the child, okay, you can enjoy screen for 6 days, but 1 day, there should be no screen. Yeah, people are laughing. That's not practical. Playing with traditional toys more than video games, right? Okay, that's another option. Then TV shows, how do we know whether it's a good show or a bad show, right? So these are common educational good TV shows. Peppa Pig, Sesame Street, Coco Tree. Alpha Block is a cartoon where you can learn about letters, and Number Block is a cartoon where you can learn about numbers, and Sid the Science Kit. Okay. Yeah, I can see the students are also taking photograph for future, I suppose. Okay. It will not come in your final year, don't worry. Right. So how to recognize an overstimulating cartoon? Some cartoons are very overstimulating and very bad for the child. So how you decide this? If a child is constantly chewing fingers and rocking their body, some children are like this, and then rocking their body. That is a high-paced show, not very good for the child, right? They should be relaxed and watching. And sometimes the child is so glued to the TV, they are like in a zombie state. When the mother is calling, the child will not answer because they can't take the eyes out because the screen is moving so fast, they are afraid that they will miss something. So they will just look at it like that, right? Like a zombie. That's not a good card. And child is not responding to your voice or get irritated if disturbed. Okay, bad. And after the show, if a child start having temper tantrums, laughing by himself, hysterical laugh, poor eye contact for about 1 or 2 hours. Some children after a TV show, they don't like to look at the mother because they are all thinking about the show. So if they look at the parent will start asking unnecessary questions that their concentration is lost, right? So they will keep to themselves and laughing and avoiding eye contact, like an autistic state for about 1 hour after a show. That's a very bad show. And then, sorry. Then another one is primary colors, saturated primary colors. You can't have more than one saturated primary color, right? Now, primary colors are red, yellow, and blue. So in a good cartoon, there should be only 1 or maximum 2 primary colors and other secondary colors. Okay. Now this cartoon, is it a good one or a bad one? It's a bad one. You can see red, yellow, blue, all the 3 primary colors, saturated, background is red. This is very stimulating, hyper-stimulating to a child, very bad for a child. Okay. Veera, good or bad? For a child below 2 years, especially. Bad. Why? There's red, yellow, dark green, all saturated colors. Our Marvel. Red, yellow, blue, all saturated colors. Okay. Now look at this cartoon. How many colors saturated? Only 1. Only red is a saturated color. Sorry, only red is the primary color. All the others are secondary colors. Only blue, this is the color palette. So only blue is the primary color. All the others are secondary colors. And you can see it's very easy for the eye, right? For a child. So these are good cartoons, right? Sorry. And then avoid scenes that are less than 4 seconds and mesmerizing animations like object and people flying around and spiraling. You can see some cartoons, there are people spiraling and objects are going. The child can't concentrate on what's happening on ground level. They keep looking at the spiraling effects. And those are again very bad. That will again lead to a dopamine rise and lack of blood supply to the frontal brain. Okay. Now, what cartoon will you select for your child? Motu Patlu or Winnie the Pooh? We come back to the last slide. How many primary colors in Winnie the Pooh? Only red is there. All the others are secondary colors. But here, red, yellow, blue, dark orange, many primary colors. And if you have seen Winnie the Pooh, it's a very slow-paced cartoon. But Motu Patlu is very fast-paced. And here there are no unrealistic movements. But here you can see people flying around. Even the legs are like mesmerizing movements. So this is good for you, but not for a child below 5-year-old. Okay? A child who continuously watch Motu Patlu will have, I'm not against Motu Patlu. I watch it. For me, it's good, right? That's a good cartoon, but not for below 5 years. Right? Pediatricians, normally we watch cartoons, right? Because we need to know what's happening in children's world. Right? We also like that, right? But for children below 5, these are not good. Okay, because fast-paced, unusual, unrealistic movements and too much saturated primary colors. Those are qualities of a bad cartoon. So too many primary colors, fast-paced, unrealistic movements, only one primary color, slow-paced, normal movements, and it has an educational value. Motu Patlu has education value. It teaches you not to steal from people, not to harm people. There are a lot of education values, but those values are masked because of the other bad effects. Okay. So what are the take-home messages? Number one, digital screen exposure affects language, especially in children below 2 years. Therefore, ideal is 0 screen time for children below 2 years. Okay, except video chatting, where you can talk with a parent through Skype. That is not digital screening. Then what and how child uses digital screen here is more important than the duration. Okay. Then parent guided screen time can be beneficial compared to solo screen timing, because it will enable the child to be creative, interactive, and ask questions. Then encourage active play, regular face-to-face interaction, and outdoor activities to improve language. Right? With these activities, the child's language will improve rather than glued to a screen. Then finally, slow-paced, low-color, realistic, educational TV shows can actually improve a child's language, right? So it should be slow-paced, low-color, realistic, and educational, right? Thank you very much. And if you have questions, I am happy to answer. Yes.
Can there be any language regression in a child who already has very good language?
Language regression. Yeah. Sometimes, not very commonly. What we see commonly is language delay, but with prolonged screen time. There was a study where they have found out that if the child below 3 years, I can remember 3 or 4 years, if they're exposed to more than 4 hours a day, they can have language regression. But the same study, what they have found that once you avoid screen for at least 6 months, most of the delayed language can be recovered. Okay, but regression has been reported, but commonly it's delay. And can screens cause autism? That's the other question a lot of people have. Can digital screen exposure cause autism? No, right? A child who is prone to autism can exhibit signs of and symptoms of autism very quickly if exposed to prolonged screen. Okay, so a child who is prone to get autism, right? By exposing the child to a screen, the manifestations will be worse and they will come quickly. There are no studies or scientific base which has shown that autism can be caused directly by screen. So a child who is prone, there are a lot of children now with autistic behavior we are seeing who are very prone, but if the child is in a, growing up in an environment where there's very low screen exposure, lot of stimuli, their autistic spectrum can be pushed towards the milder side. B, their symptoms might appear late when intervention is very easy. But by exposing to screens below 2 years, children who are prone to autism will go into the severe part of the spectrum and they will manifest at a very early age.
It's a wonderful lecture. I would like to suggest you to make a YouTube speech on the same thing. This is I think it's good for the general community. It's same for us, but it should go to our community. It's so important. So one thing about this digital screen, when you take that digital books, e-books, you took it as a possible barrier, but when you get the normal books at this early childhood, we normally encourage children to read books. If they keep on reading normal books at this early childhood, really first as this e-book. In terms of this stimulation,
E-books, e-books for an older child is okay. That's what you're asking. No.
In early childhood, e-books and other normal books.
No. What the research suggests is even at early childhood, especially below 3 years, e-books are not going to be beneficial compared to the normal books. They should get the idea about a book, reading, turning pages, because when you're reading a book, there are a lot of other things attached, right? You should, you are using the hands. Your hand skills are prepared. You should learn how to look at the index, go back, look at the printed material, point. Learn. Those things are not with the ebook. Ebook is good for an advanced child who has learned from a normal book, and now they want to save time. They will be using an ebook, but not for a child below 3 years. For a below 3-year child, traditional books are better. What they say is traditional toys are much more important than the sophisticated toys when it comes to language development below 3 years. Right? Even at medical student level, e-books are dangerous. When you want to read something, you search a word, and then only that part appears in your screen. When we are going through a traditional book, we go through the page, we read that part, but then we see that, okay, there are certain other important things. We tend to read around the subject. In an e-book, we don't read around. We are reading only that specific point. You get what I mean, right? So you type, okay, neonatal jaundice, that part will appear. But in a real book, you see neonatal jaundice. On the other side, you see a hepatic dysfunction. Okay, you think, okay, there's something connected to that. Better read that part as well. Okay, so I don't think nothing can replace a traditional book. Only thing is ebooks are fast. So if you want to read something faster, get quick knowledge, yes. But for a child, no. Actually, this lecture I gave for you because you will be in contact with parents. So it's every time, when parents come to us, when the moment the child cries, what do they give to settle the child? They give the phone. So this is a wonderful opportunity. Tell them not to give the phone. What I do is I take the phone and keep it down. And the mother freezes. Doctor, right? Even the mother thinks that phone is the way to settle down a child. It's a very dangerous thing, right? 4-month, 5-month-old child, they come for vaccination. To soothe them, they give the phone. Right? So as doctors, whenever we are in contact with parents, even medical students, please tell them not to use the phones, at least until the child is about 2 years. Yeah.
I work on kids, especially around 6-year-old, 7-year-old. Doing something under local anesthesia, what you do is keep a screen, YouTube, distract.
Yeah.
Do you think it's a good thing or bad thing?
That's okay. Because that's a surgical intervention. Because our primary target is not to create a bad impression about the procedure. For a procedure like that, that's okay. What I'm telling is day-to-day things. Whenever a child is crying for some very minor thing, the first thing the mother will give is the phone to sedate the child. And the child will also. Now, at 1 year, those days, when we were medical students, how do you know pincer grasp is good? By putting some object and asking the child to pick it up. Now, by 1 year, we know they will quickly do the phone. Pincer grasp is intact. Right? So I'm talking mainly about children below 3 years. Above 5 years, using a screen to distract for a procedure, no harm. Because then the child will not remember that bad experience. That's okay. This is mainly for below 3 years, especially below 2 years. Even for vaccination, do not, you show love during vaccination. The child will settle down. We don't show love. What happens nowadays, when we are vaccinating, no one is settling the child. Mother is recording the vaccination. We have come to that level, right? The painful procedure, mother is recording it. What fun can you get by looking at that video where the child is shouting in pain while being vaccinated? See, we have gone to that level of a digital video. Right? Doctor may record certain. Maybe to sue me, maybe that's okay. That's and also be careful. Sometimes parents will say he's very brilliant. He can count from 1 to 30. He's still 1.5 years. He can count from 1 to 30. Are you happy or are you scared? 1.5-year-old counting from 1 to 30. Is he counting by realizing what is 1 to 30 or memorizing? He's just memorizing. He will know how to count, but he don't know why he's counting. Right? So if a child just say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, then the mother say, yeah, and come on, keep on going. It's not good, right? Because the brain is not adapting. Brain is not analyzing. but it is giving priority for memorizing. If your memory goes up, your analysis will go down. Okay, so you have to keep space for your analytical power. Yes, yes. Speech apraxia is a problem where the signals are not going properly. Then speech therapy. You have to give proper speech therapy and speech exercises so that the child can overcome the signal defect and still learn how to speak. You have to give intense speech. And speech apraxia, very easy to diagnose. Those children will have not only speech apraxia, but motor apraxia. So a child who has difficult, has a tight, difficult feeling, their fine motor skills also are slightly delayed. So when they are a 3-year-old child with apraxia, we'll draw a circle, but also that circle is also very abnormal circle. So if you have a fine motor problem and speech problem, apraxia is high on the card. But all these things have speech therapy and behavior therapy can do wonders if you detect early. But my target is not to talk about treatment, but mainly to prevent. So why should we talk about treatment when we can easily prevent it from happening?